Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about cellulite. So cellulite is a really big problem. It affects a lot of women. It can also affect men, and it can occur in a lot of different parts of the body, such as the arms, stomach, and especially the thighs, which is the number one area where we tend to see the cellulite, including the buttocks. So cellulite can occur in just about anyone at any age. It doesn't spare you if you're slim and working out or if you're overweight. So anyone can get cellulite. It seems to perhaps be a bit of a genetic tendency. We don't know exactly why it occurs in some patients more than others. We do know physiologically what's happening in the skin when you do have cellulite, which is these pouches of fat which are surrounded by fibrous connective tissue that is kind of scarred down sometimes, has lost some of the vascularity, and so those fibers shrink and then the little fat pockets kind of pooch out around those fibrous bands. So when we're dealing and trying to treat cellulite, some things you can be doing at home. I think manual massage can be helpful. Again, any sort of manipulation of the skin to increase blood flow, to help the skin just be healthier is a good idea. You can use certain oils to do that at home. But of course we know that that's generally not enough, because if there was an over-the-counter cream that really truly worked on cellulite, that would be amazing. So we have all types of procedures that help to shrink those fat lobules and to also help address the fibrous bands that cause the dimpling in the skin. So some of the procedures we use are, for example, we have a procedure called ThermiRF, where we can put a little probe under the skin using radiofrequency energy, and that probe travels and is able to basically just cut the little bands that are pulling the skin down. It also helps to stimulate collagen and make the skin healthier. So when the skin is firmer, it tends to pooch out less. And then of course it also kills the fat cells at the same time, and we can hear them just kind of popping as we're doing the procedure. So that's a really great procedure, just done with local numbing only, very minimal recovery time. You have the procedure and you're up and ready to go. You usually wear a compression garment just for a few days after a thermi procedure for cellulite. And then we also do something called Vasersmooth, where we use ultrasound. So this is high intensity focused ultrasound that we also use to do liposuction with. But we can also use this to treat cellulite either during a liposuction procedure or even by itself. So again, the skin is just numbed with a local anesthetic, and then the ultrasound is delivered through these little probes right under the skin, and the probes for Vasersmooth have a little like a scalloped edge on them, and they're able to just grab those bands of fibrous connective tissue, and we can kind of feel some resistance when we get to them, and then we deliver the energy and we pop right through those bands. And then of course the Vaser ultrasound also helps to kill fat cells at the same time, and the heat also helps to regenerate collagen. So we get an improvement in all of the different causes that are contributing to the cellulite with the Vasersmooth. So those are the two minimally invasive procedures that I think work really well and are usually just a single treatment, although sometimes we have to go back and repeat the treatment if the cellulite is very stubborn or it needs an extra dose of energy to really help it along. And then we have a lot of non-invasive procedures for cellulite as well. One of my favorites is Velashape, and this uses 4 different modalities. So it has infrared heat, radiofrequency, suction, and just manual manipulation of the skin. So it again helps with all the different modalities that are causing the cellulite. The suction pulls in the skin, and then the RF and infrared energy are more directly able to penetrate through the skin as it helps the top layer of skin just kind of thin out for that energy to go through. And then the manipulation of just massaging it over the skin helps to break up the bands of fibrous connective tissue. It helps to improve circulation in the skin. It helps to heat the fat lobules and cause those fat cells to shrink and die off. And then of course it also makes the skin healthier at the same time. And this is a procedure that's not a single treatment like the other two minimally invasive treatments. So you would come in maybe once a week for a series of treatments, but the advantage is that there's absolutely no recovery time. It's completely non-invasive, and usually you can see a little bit of an immediate change and then more over time. And then we have another procedure called Exilis Ultra Plus, which also uses radio frequency along with some ultrasound energy. And that helps the radio frequency drive into the skin a little bit better, heats the tissue, again with the massaging over the skin. It helps to improve circulation, it helps to kill some of those fat cells, and really gives a nice smoothing and tightening effect to the skin, and in that way helps with cellulite as well. And then for dimpled areas in the skin caused by cellulite, we can also basically undermine. So we can use a needle and manually put that needle under the skin with a little cutting edge, and we can undermine the skin and basically cut those bands of fibrous connective tissue in that way as well. And then oftentimes when we're doing that, we'll add a filler, such as Bellafill, which is an excellent filler for areas of cellulite, but any of the fillers can certainly be used. Bellafill just tends to last a little bit longer, as does Sculptra, because these fillers stimulate your own collagen, but we can literally fill them in and you can see an immediate improvement in that cellulite, where it has plumped out those areas of depression, and then over time it's going to stimulate your own skin to make new collagen fibers. So that is also a really useful way for us to battle cellulite here. And sometimes we use procedures in conjunction. So we may do the Thermi, and then you may do a non-invasive procedure afterwards for maintenance, or we may do Vasersmooth and you'll do these for maintenance, or you'll do these as standalone procedures, the non-invasive treatments. We may use these in conjunction with fillers. So all kinds of possibilities. And our goal is to try to help you find the best solution to help you not only get rid of the cellulite, but then also help maintain it. Because cellulite is one of those things that we can get some permanent improvement on, but it can recur over time, and so a little bit of maintenance is warranted periodically depending on how your body reacts in the future. So that is it. Of course, continue to stay healthy, eat well, take good care of your bodies to help reduce inflammation and stress and other factors that contribute to aging faster. And we look forward to helping you with all of your skin problems and dealing with your cellulite. Thank you so much for watching, and do subscribe to our YouTube channel. Thank you.